I think a lot of times in the healthcare field, we just focus on the pathophysiology and the anatomy and wanting to, just treat that patient's diagnosis that's written down on our chart and then send them out the door, tell them their medications and be done. But the healer's art encourages us to do more. It encourages us to see them as our brother or sister, to not only take care of their medical needs, but also take care of their spiritual, of their social, psychological, just to get the big picture. The healer's art here at the College of Nursing, it makes us strive to not only heal them and heal their bodies, but also heal their hearts and heal their minds. I'm Sarah Leggett from North Carolina and a nursing student here at Brigham Young University. It was our first day in the clinic in a crawl. We don't have assignments yet, so we kind of waited with the patients in the waiting room area because patients were starting to come in. There was both a man and a woman at the very front. They were singing different Bible verses and also sharing spiritual messages through their song. And it was beautiful music, just very melodic, very powerful. And they just kept on referring to Christ as the healer and how that, if they came in to see the doctor today, it would be no use unless they were reminded of the ultimate healer, which is our Savior Jesus Christ, and incorporated Him with the care that they receive. So without Christ, there could be no healing. And that really touched me, and I began to cry. And I'm not a person who gets emotional, ever. And the Spirit touched me and showed me these people understand the healer's art. They understand that it's not just about what we do with our hands, it's about having the Spirit to be with us. And it's about recognizing the Savior as where true healing comes from. After that experience, it caused me to reflect a lot on how I could incorporate that in the healthcare I deliver here in the United States, because we can't, start the day off with an opening hymn and prayer. Of course, that would offend some patients who are of different religious denominations. But it showed me that I can incorporate spirituality and tend to the spiritual needs of my patients in the U.S. by doing a couple different things. It's totally appropriate to talk to patients about their spirituality, no matter what that spirituality may be, and to be motivated to get them any type of spiritual assistance that they need, whether that's contacting their minister, their bishop, maybe getting someone from the community to come and pray with them, that they feel comfortable with that person. Because a lot of times in the hospital, especially, patient spiritual needs gets overlooked, and I don't think that's fair because that's a part of the healing process for many people. So it encouraged me to be proactive about contacting anyone that I can to make that patient feel more comfortable. Until I had that experience, I was scared to even think about that because I was scared of the repercussions that would happen. But my spirituality is a huge part of who I am, and it's a responsibility I have to tend to the spiritual needs of all of my patients. I think a lot of it had to do with the fact that they were sharing their message through music. And so I think it took that experience from the people in Ghana sharing their belief and their faith with patients through music that touched me the most. And I think that's what God knew I needed to have that lasting impact in my life. And it was just beautiful, strong, and powerful music. And if you've ever seen Ghanaians sing, they're not quiet, they're loud, and it's beautiful and, very bold. And to see them share their beliefs in such a bold way, no fear, showed me that I can do the same thing here in America.